Hello, and welcome to the Hennepin County Consumer Support Grant electronic training session. Completing a CSG training session is the first step in the enrollment process, and we do keep track of all people who have attended, so you may receive credit. Please complete the registration form and email it back upon completion, along with any questions you may have regarding the program. There are 5 Hennepin County CSG team members who manage over 650 CSG recipients. Our contact information is on the front of the CSG main program packet, which includes the coverage line phone number, fax number, email, and our address information. We do prefer email correspondences as this is the quickest way for us to respond. The Minnesota Department of Human Services does not allow people who are currently enrolled into the Minnesota Restricted Recipient Program to access the CSG program. These individuals are limited to 1 doctor, 1 clinic, 1 pharmacy, and 1 hospital due to historic fraud or misuse of medical assistance. A person who is identified as being enrolled would have received a letter in the mail from the Minnesota Department of Human Services. So what is the Consumer Support Grant? It is a flexible alternative to formal medical assistance home care, such as state PCA, home health aid, and private duty nursing. When an individual is eligible for these services, they can access CSG, which is the state-determined portion of the MA home care standard. A person must give up PCA in order to enroll into CSG. By requesting CSG, you are agreeing to end state PCA, private duty nursing, or home health aides. The Consumer Support Grant will always be less money than state PCA. It will be at least 50% less, sometimes more for most families, and is not determined based on eligible hours. The state PCA hours that you have been told the person is eligible for are converted to a monthly cash grant that is based on the PCA assessment, and we are not able to increase the amount. What are the advantages of CSG? The biggest reasons families choose CSG is for the flexibility. Parents and spouses can be paid staff even if they are the responsible party. Many families cannot find reliable staffing support through the state PCA program. Families can hire staff they know and trust. CSG allows the purchases of goods and services for items that relate to the functional limitations and assess needs for the person with a disability. This provides equal access to typical community supports and services. The eligibility requirements of CSG are that you must live in Hennepin County for Hennepin County CSG. Out of the 87 Minnesota counties, 40 offer CSG. All metro counties offer CSG, including Stearns County, which includes the city of St. Cloud. If a person moves to a county that does not offer CSG case management, a surrounding county may manage the case, or the current county may choose to hold on to the case. When a person moves to a new county, that county's CSG administrators administer CSG under its own guidelines, and you may need to attend their training session. All counties have different processes to enroll and maintain CSG. It is very important to notify Hennepin County as soon as you move. If you move out of state, CSG will end and it will not transfer to your new state. The second eligibility guideline is that you must maintain eligibility for MA home care services. People who are currently on MA and enrolled in a PMAP are eligible as of January of 2019. A person may not access CSG at the same time as MA home care, waivered services, or county paid respite. The person, their guardian, or managing party can purchase the care and supports for the eligible recipient themselves. CSG is a consumer-directed service, and the families do most of the work. They must write the plan, cooperate with annual assessments, maintain PCA and MA eligibility. The person must meet an institutional level of care, have functional limitations, and requires ongoing support. Institutional level of care means that the person had a PCA assessment and qualifies for PCA services. The person must live in a natural home setting that is not licensed for board and care. Foster care is a licensed setting. If your home has a foster care license, only persons not receiving foster care funding are eligible for CSG. What are the allowable expenses for CSG? All staffing and expenditures allocated on the plan should be for the person receiving services only, unless the family is requesting parental health and safety education. No academic expenses will be approved because this is seen as the school system's financial responsibility. The expenses need to be directly related to the disability. An example would be if a family requested a computer. We would deny the request, but if they requested a special keyboard or a touchscreen adaptation, we would approve it. It would delay or prevent out-of-home placement. Items must not be covered by other pay sources. We are unable to pay insurance co-pays, deductibles, and MA-covered services from out-of-network providers. Costs over and above normal costs of care for non-disabled individuals. An example is if a family were interested in adaptive gymnastics that offers classes for non-disabled children, CSG could be used for the additional expense it would cost over and above the amount of a non-adaptive class. We do pay for the full amount for adaptive classes held at Courage Kinney. The items must be cost-effective, such as if a family requests the most expensive beanbag for their sensory room, but if there is another beanbag that is just as functional and less expensive, we would approve the amount of the less expensive functional bag and the family would pay the difference if they want to purchase the more expensive one. Additional information regarding our special diet policy is we need a prescription and it is for the CSG recipient only. The diets that will be approved are outlined on the special diet grid that is located on the last page of the CSG main program packet. The family would submit receipts to their FMS per item purchased or by circling the products they are seeking reimbursement. The CSG plan will indicate the maximum amount allowed based on the age of the person and the type of diet they are eligible for. The CSG team will review the plan to ensure the correct amount is listed and will approve the plan after receiving the prescription verification. The FMS will only reimburse items that indicate gluten-free, for example, or are special items versus reimbursing for items like bananas, which are also gluten-free but everyone uses. The intent of this service is to pay for items that cost more. For example, gluten-free bread is smaller and is $7 a loaf versus typical bread that is $3 a loaf. Homemaker chore services are almost never approved for two-parent households. This request is approved only as related to a person's disability needs. For example, an individual in extremely frail health that requires an unusual level of cleanliness, such as the person crawls on the floor a lot. This service is approved on a case-by-case basis only, and the expenditure limit is $208 per month or $2,500 per year per household. Regarding transportation, We do not approve transportation costs to and from medical appointments or therapies due to MNET through MA does reimburse families for gas and mileage at a standard rate. Many families do not know about this, and you can call the number on the back of the paper MA card to inquire on how to request the information. What are shared services? It is the ability for a PCA staff person to provide care or shared services for up to 3 people concurrently. The family will develop a proposed schedule indicating when they will use shared services, which must be outlined in the CSG plan and a DHS 6633D shared services agreement form needs to be completed. This form describes the personal assistance services or activity type and the agreed hourly rate. The FMS will instruct the staff person and family on how to record the shared services on timesheets. The FMS agency must be the same for all CSG recipients sharing services. Paying parents of minors or spouses is one of the main reasons why families choose CSG. The salary earned is considered income and will affect other income-based programs such as Section 8, subsidized housing, food support, cash assistance, and child care assistance. Staffing is used for the direct care of the CSG recipient only. Paid parents can only work a maximum of 40 hours per week. The 40 hours is shared between both parents, even if they do not live in the same household. Most grants will not allow parents to work 40 hours per week. The maximum hourly rate is equal to the state home care hourly amount of $17.80. Parents need to request any hourly pay rate changes from the CSG team and the FMS. Parents cannot be paid to provide nursing tasks for complex home care budgets. Some changes to the pay rate for parents and spouses effective July 2019 are a 3.1% increase in benefits. If working 600 plus hours, they can opt out of PTO, and all can opt out of workers' comp and Social Security when initially signing up. How is your budget determined? A home care assessment is done at least annually. The PCA assessment completed by a MnChoice assessor or a nurse from the Minnesota Visiting Nurses Association. We do have access to any of those assessments. Any assessment completed by a PMAP, such as Health Partners, UCare, or Blue Plus, we do not have access to, and you will need to provide us a copy of the assessment in order to provide you with a CSG monthly allocation and service dates. The CSG budget is based on the home care rating plus the number of dependencies indicated in the assessment. We translate these two values and determine the CSG monthly allocation amount. It will never equal the amount of units or hours that a family is eligible under state PCA. The Hennepin County administration fee will show up on the service agreement that is mailed to the FMS and family, and the amount is not available for use under the grant. The CSG team will provide all new enroll families with their monthly allocation and service date span. What's a financial management service or FMS? The FMS is an agency required to help manage payroll duties and expenditures. They will provide an ongoing monthly report of spending. They can pay for or reimburse for goods and services for licensed and non-licensed community services. They support the families to be the direct employer by helping you meet the Department of Labor laws, employ staff, collect time cards, and process paychecks are additional duties that FMSs do. The families write the plan, the county approves the plan, the FMS collects receipts, time cards, and pays out funds. Choosing FMS is a requirement of the program, and a person will not be enrolled if they have not completed the FMS intake process. Please refer to the FMS materials attachment paperwork that lists all FMS agencies that families can choose from to manage their CSG funds. And when contacting agencies, verify if their fees have changed. Be a consumer. Find one you feel comfortable with. Ask questions that matter to you, such as, how does your payroll work? What are your pay cycles? Do they have direct deposit? Will the FMS coordinator come meet you in your home or send paperwork in the mail? How long will it take to process employment paperwork and get staff started? Who keeps receipts? Can the CSG account be accessed online? Families should compare, then call one or more. All agencies do a great job. Find the one that suits your needs best. Financial management support rates. Review the rates of all agencies and verify that they have not changed because they can change them as they see fit. Each one charges differently. Some charge monthly, others charge per check written or a percentage of the budget. Families do not need to be math majors to be successful on CSG. The FMSs can do the math for you. Find one that matches your family's needs best. What is a support planner? Support planners are used by some families that need extra support with writing their plans. The CSG team can provide families with a list of certified support planners that have been trained to write CSG plans. We do not encourage the use of a support planner unless there is a language barrier, a home care nursing or private duty nursing level of care, or if the family has other circumstances that require an unusual level of support with their plan. A person with a home care nursing budget requires additional training and forms that your support planner can help you with, if you choose to hire one. There are support planners that speak different languages and all charge different fees that families can pay directly out of the CSG budget. A plan utilizing staffing only should take around 2 hours to complete. Plans that utilize staffing and expenditures may take up to 5 hours to complete. Support planners may also be used to help complete FMS paperwork and complete time cards. Families do drive the plan, so ensure that you stay in charge of how you want to allocate funds. If a family uses a support planner but decides not to move forward with the CSG enrollment, you may be responsible to pay them out of pocket. Please clarify this information prior to working with them and reach out to the CSG team to request a current list of support planners. Now we will review the steps to having a CSG plan approved. The first step is to complete the training requirement. Second, you will be given a state-set CSG allocation and date span. Third, you will begin to develop your CSG community support plan and hire your financial management support provider, also known as the FMS. Fourth, you will submit your plan. The fifth step, Hennepin County CSG team approves the plan and will CC the family on the FMS approval via email. The sixth step, the FMS submits the budget. The seventh step, Hennepin County CSG team sends the FMS the county service authorization number. And finally, the eighth step, services begin and everyone begins monitoring and evaluating the budget ongoing. How long does this process take? Application materials must be submitted 2 weeks prior to the start date. If we receive the new enroll plan by the 15th of the month, CSG could start as early as the 1st of the following month. The CSG start date is always the 1st of the month. If your state PCA is active and you are overspent, you will need to wait to start CSG until the budget is on track. We coordinate with your PCA agency and the state to close that program and open CSG. This is also true if families decide to switch back to PCA from CSG. We would connect with the FMS to make sure that spending is on track to close for the 1st of the month, and we would need to know the chosen PCA agency and NPI number in order to request state PCA again. What are the family's responsibilities? Attending or completing an informational session on CSG, developing a support plan and allocating the budget, selecting a financial management service or FMS, which is a requirement of the program. You may not enroll unless a FMS is chosen and you have completed the intake process with them. The family will arrange for and purchase the supports in the plan. Monitor health and safety, monitor the budget on a monthly basis and overall. CSG funds are awarded monthly. In the first month, the budget cannot be spent more than the monthly amount. Unused funds roll over to the next month. Higher price items may have to wait until later in the plan year. At the end of the plan year, the funds will not roll over to the next plan year. You will need to use the funds or lose them. Any overspent funds must be repaid to the FMS in order to continue CSG. The managing party is responsible for any takebacks. You will want to submit expense reports as directed, follow the Department of Labor regulations, notify the county of any changes in eligibility, which includes changes in address and/or phone number. If we can't reach you, it could interfere with the renewal process or other vital communications. If CSG closes for 3 months or longer, you must reapply. It will close due to not renewing, not following through with the reassessment, and/or not submitting renewal paperwork, and if MA closes. CSG is self-directed, thus it's the family's responsibility to maintain eligibility. This means that even if you are not contacted by MVNA or if you do not receive your paperwork, families are responsible to know when their renewal is and to contact us if they are not contacted. Even if you report these changes to your financial worker or Rule 185 worker, they do not inform us of these changes. It is extremely important that families read and respond to CSG mailings in a timely manner. All CSG mailings have CSG somewhere in the return address on the envelopes. This makes them easy to identify. We know how much mail families get from the state and county. We do not send mailings unless it is very important. Failing to respond may result in grant disruption. Always contact the CSG team if you have questions, and as always, keep a copy of all CSG paperwork for a minimum of 2 years. The CSG team responsibilities are to approve the plan. Then we authorize the grant, monitor the person's expenditures in health and safety. We also initiate the renewal process in order to renew the grant annually. The FMSs will contact the county if unusual spending occurs and will send letters of technical assistance if the family is overspent or underspent on their CSG budget. 4 letters of technical assistance results with involuntarily exiting from the program. Families may choose to make a revision to their current plan anytime during the plan year except during the last 30 days. If there is a health or safety concern, a request to move funds to staffing is the only approval during the last 30 days. This is due to us needing time to initiate and complete the renewal process. All revision requests can be emailed, faxed, mailed, or phoned in. Please allow up to 2 weeks for a response. The CSG team must approve all revisions prior to the FMS authorizing the reimbursement. If a family is making these requests too frequently, you may be asked to submit requests quarterly. The renewal process consists of the CSG team sending the Minnesota Visiting Nurses Association, or MVNA, an assessment referral 60 days prior to the CSG end date. The renewal packet is mailed to families 45 days prior to the CSG end date. If the family receives the renewal paperwork and no call from MVNA within 2 weeks of receiving the packet, please call the CSG team so we can follow up with MVNA. If the family receives a call from MVNA but no packet came in the mail, please call the CSG team so we can send you the paperwork. Once MVNA completes the assessment, they send us the results and we will send an allocation email to families providing the new CSG amount to use for the new plan year. When families receive the allocation email, they will complete the paperwork and email or fax it back to the CSG team. This process needs to be completed within 2 weeks before the last day of the plan year, or there may be a disruption of funds. Important reminders are to follow Department of Labor regulations. Only purchase approved items in the plan. Get pre-approval before making additional purchases. Do not pre-sign timesheets. Do not overlap staffing. Turn in appropriate receipts within the month and do not make purchases beyond the plan dates. Please reach out to the Hennepin County Consumer Support Grant team with any questions or for additional information.